First on our agenda, we have Katrina Rothenberger to give us a COVID-19 update.
Hi, good morning. My name is Katrina Rothenberger. I'm the Public Health Division Director for Marion County Health and Human Services. For the COVID update for today, as of yesterday, we have 1,365 total cases, which includes 1,315 positive tests, and we've tested 16,248 people total in Marion County. We have been getting some questions about a large spike in cases. A few days ago, we had 51 cases, and 34 of those cases were associated with a long-term care facility, which Oregon Health Authority should be reporting on this week. Another few cases are related to a work site, and another one is associated with another long-term care facility. They're not currently in an outbreak status yet, so that will not be reported until if they ever reach the threshold of 3 cases. The rest of the cases are still being investigated, could be sporadic or associated with another work site, but they're still working on that case investigation. The following day, we only saw 11 new cases or 11 new positive tests with 13 daily cases. So as we're increasing our testing in these work sites and with communities that have been disproportionately impacted by COVID, we do expect to see some more cases in our community. Our testing positivity rate has gone down. Early in the pandemic, we were around 12%, and our percent positivity rate as of yesterday is 8.4%. It's still a little higher than the state average. And then I just wanted to mention that today Governor Brown's mask order goes into effect for businesses. But, you know, we've been encouraging masks for a while as just a precautionary measure for folks when you can't maintain 6 feet of social distancing. The 6 feet is a good way to keep the virus at bay, but that's not always possible, especially as we're reopening. And the mask order guidance is on our website, so you can view it online. And there are some exemptions, so for children, for folks with a disability or other health complications. So we'll be posting on our social media website this week about masks and how it can protect others.
Thank you, Katrina. Are there any questions?
Well, you know, I like to put you on the spot, Katrina. I'm sorry, but I've been getting asked, and I don't have good answers. So when will it be available, or if it is today, how would you do it? If you feel like you've been exposed, that you can really get checked out, and not just, where are we at with qualifications to be tested?
So the OHA guidelines still, you should still call your doctor and say, I think I may have been exposed. They'll probably ask you about your symptoms. So we're still trying to test people who are symptomatic. We might look and see, we might ask you about that exposure. So are you sure you were exposed? Do you know that someone that you came into contact with has a confirmed COVID case? If so, then that makes you a good candidate for testing. And especially if you have symptoms, the shortness of breath, coughing, fever. And then other communities may be able to access testing if they work in a high-risk setting, but we're still trying to work through the testing strategy for Marion County, further refining the OHA guidance because of capacity. Communities who are disproportionately impacted can be tested asymptomatically, but we're still really trying to focus on the folks who are symptomatic and or working in those high-risk settings and have a confirmed case or
so. It's probably not there now. Do you think it's working towards a point where if a person feels like they're suspicious, would like to know, will we get to there?
I hope so.
I
I think
hope
there's
so.
some really innovative things going on in Oregon. The University of Oregon is working to validate a saliva test. So at some point, I do think that there's going to be more widespread and wider availability of testing.
I can't pass it. I've been sticking my tongue out at the University of Oregon for years. This is going to work great. Thank you.
Katrina, could you talk a little bit about that long-term care facility and what's being done to address the outbreak there?
Yeah, so typically a team from Oregon Health Authority and DHS will reach out to a facility when they've identified several cases and offer to do a worksite infection prevention assessment. And then recommendations are made from Oregon Health Authority to that facility. Those recommendations include cohorting staff and patients. So residents who are COVID positive, who can remain in the facility, should be cohorted together. And the same staff should be taking care of those people every single day and shouldn't be taking care of residents with non-COVID, without COVID. The other thing that we do is reach out and make sure that they have an adequate supply of personal protective equipment and rush orders to them if needed. So we did reach out a couple days ago and offer PPE. I believe they're picking it up sometime this week. And then we make contact with the facility. DHS and OHA typically have a conference call to talk through any issues or what supports they might need.
And has that happened to your knowledge?
I believe last night, and then I think another one is scheduled for today.
Okay, good. So we're on it.
Yes, we have been working with this facility and with OHA and DHS for the past several days. It is a top priority for
Okay.
both Oregon Health Authority, DHS, and Marion County.
Good. Thank you. Commissioner, do you have
Mr. Chair, thank you. Katrina, again, thank you for all your work, and Ryan's here too. I think it's interesting, we've tested, according to what you said, 16,248 people. If we have 340,000 citizens, we've only tested about 4.7% of the total population in Marion County. So I think that's interesting to know, and as we continue to do more testing, we're going to have more positives, obviously, but I think one of the good things, the trends we've seen, is the percentage of positives based on the number of tests that we're doing has gone. The trend continues to go down. If you look at a trend line, that's accurate, correct, that statement?
Yeah, so in the early days of the pandemic, we were around 12%. Now we're around 8.4%. So we are trying to keep track of the percent positivity rate over time.
Yeah. The other thing, even though you mentioned the spike we had over the weekend, the hospitalizations are still pretty consistent, 0, 2, 3. I think we had, 2 weeks ago, we had 6 one day. So we're still doing well on maintaining the system, not overrunning the system.
That's correct.
With really sick people. So, I was sharing with somebody yesterday, I go, this thing spreads really easy and quickly, but the key is not getting the vulnerable population sick and putting them in the hospital. So we're doing better at that, except for this outbreak we've had in a long-term care facility, so thank you.
Very good. Thank you, Katrina.
Great.
Sure
Thank you.
appreciate it.
Are you getting any rest?
Yes.
Okay, good.
We've staffed up quite a bit over there, so
Yes,
she has some help now.
Well, yeah, but when you have a increase in staff, it takes a lot of training and a lot of time and a lot of work. So it's good to have good people around you.
Yeah. Thank you, Katrina.
Thanks, Katrina.